I am Dr. Eric Ellenberger, and it's my pleasure to introduce myself and my medical practice to all of you through this video presentation. My medical practice has, for the last 12 years, been based at Accurate Clinic in Kenner, Louisiana, a suburb of New Orleans. I have recently expanded my medical practice via telemedicine to include Emergent Life Integrative Medicine Center located in Charlotte, North Carolina. At these clinics, we offer the management of chronic pain, opioid addiction, smoking cessation, anxiety, and depression, as well as providing other services. As an undergraduate student, I obtained a Bachelor of Science degree in psychophysiology. This course of study focused on mind-body interactions and included traditional psychology and physiology, but also course studies in alternative states of consciousness and psychoactive plants. I am now a board-certified physician in addiction medicine and emergency medicine, and I am advanced certified in pain management. I have over 30 years experience in emergency medicine and more than 12 years experience in pain and addiction medicine. This experience has provided me with excellent training in conventional medicine. While a conventional medicine approach to the management of disease is the backbone of my practice, I believe it is also important to integrate complementary and alternative medicine, otherwise known as CAM, to provide an integrative medical practice. As part of our comprehensive integrative approach, including CAM, we offer safe and effective treatment options, including the use of nutraceuticals and plant-based supplements, as well as mindful activity-based treatments, including biofeedback, hypnosis, meditation, and contemplative prayer-based treatment modalities. In pain management, conventional medications, including opioids, can be very effective, but they nevertheless have limitations and potential safety concerns. The use of alternative nutraceutical supplements and plant-based treatments can reduce a patient's reliance on these conventional medications, as well as provide enhanced therapeutic benefits that are also safer. The term nutraceutical is derived from nutrition and pharmaceutical and refers to a product that is isolated from herbs, botanicals, or foods that has physiological benefit by supporting the structure or function of the body or providing protection against disease. Nutraceuticals are typically directed at improving health and preventing or reducing the impact of disease. Plant-based herbal medications have been the core of folk medicine throughout the ages and are at the core of traditional Chinese and Asian medicine. The use of herbal medicine is time-honored, safe, and effective for many conditions, and an important tool in integrative medical management. In Louisiana, the recent legalization of medical marijuana, or cannabis, has also made the use of THC and other cannabinoids available for the treatment of pain and other medical conditions. Although the mind-altering THC component of cannabis is still illegal in North Carolina, there are other legal hemp-based constituents that are safe and available. These include cannabidiol, known as CBD, and other cannabinoids and terpenes that potentially offer significant medical benefits. It is known that there are over 100 physiologically active constituents found in cannabis plants. The amounts and ratios of these constituents impact the therapeutic benefits of marijuana and hemp extracts. Some doses and combinations are more effective for pain than others, while other combinations may be more effective for sleep, anxiety, or other medical conditions. We provide expert guidance in the role of these supplements for the management of pain, anxiety, sleep, and other medical problems. To understand the treatment of many conditions, especially chronic pain, it's important to appreciate that symptoms are multifaceted. For example, the experience of pain is more than simply the awareness of a throbbing or aching sensation arising from nerve signals generated by a herniated disc in one's back. The actual experience of pain from this source is modified by a person's emotional state, their mood, their memories associated with the underlying injury, their fears surrounding that condition, and its impact on their quality of life and their ability to function and cope with their pain. To fully treat pain, therefore, it's important to engage these other variables in an effort to improve the pain experience and enhance a person's ability to function with their pain. Healing does not come from medications alone. We also stress the importance of including mindful and spiritual dimensions of treatment as well. These dimensions include mindful activities such as meditation, yoga, tai chi, hypnosis, guided imagery, music, and prayer. Sometimes it may even include getting a dog or other pet to improve coping skills and hasten healing and recovery. When engaging these mindful activities, one enters an alternative state of consciousness that allows for modifying the pain experience variables, including memories, emotions, and fears, to dismantle their magnifying effects on pain and improve one's ability to cope with their pain. The incorporation of biofeedback techniques can facilitate the learning process when beginning to apply mindful exercises for pain management and other conditions. The integration of meditation techniques and contemplative prayer with neurofeedback is a unique program offered at our clinics. Our clinic is equipped with neurofeedback equipment to train patients as part of their therapeutic meditation or contemplative prayer treatment modalities. The facility is equipped with 32-channel research-grade EEG equipment and can produce EEG reports to help guide our patients' progress towards their therapeutic goals. In a neurofeedback session, an EEG device is used to monitor the patient's live brainwave activity while practicing their meditation or prayer. In the biofeedback process, brainwaves related to calming are associated with delivery of pleasant sounds such as songbirds, while more disruptive or distracting brain activity delivers storm sounds. Through the use of these sounds as a biofeedback process, the patient learns to more efficiently achieve mental states associated with enhanced calming and reward. The use of this neurofeedback system helps to train the individual to calm their mind and achieve a state of consciousness that can be used to reduce pain and anxiety as well as to facilitate sleep. Additionally, it is believed that this training process may also aid addiction recovery. The optional use of Nutraceuticals, including CBD and other cannabinoids during biofeedback sessions, may facilitate the process. For those who practice faith-based meditative prayer, these sessions can be combined with neurofeedback to further deepen their experience. At the end of each session, a report is presented to the patient where the EEG readings are shared with the patient to instruct them about how their brainwave activity reflects their training experience. Brainwave activity, defined as alpha and theta, commonly reflect calmness. As multiple sessions are conducted, one can periodically assess the evolution of the individual's brainwave patterns over time. Given the state of our world as it faces the COVID-19 pandemic, while people are struggling to understand how they may avoid developing this disease and how to reduce their risk of dying from it, I would like to take a moment to discuss the role of integrative medicine in COVID-19. Regarding the avoidance of developing the disease, conventional wisdom emphasizes physical distancing, masks, hand washing, social isolation, and potentially vaccination. However, little has been published regarding how, before contracting the disease, one can protect oneself from experiencing a severe outcome if one subsequently does acquire the disease. The majority of people who have serious outcomes from COVID-19 have underlying illnesses, including high blood pressure, heart disease, and lung disease. Therefore, people with these conditions must work closely with their clinicians to keep these conditions well controlled. However, for those people at increased risk of developing infection, there may be additional measures that may reduce the risk of a serious outcome if they develop the disease. While the research available to find these measures is limited and our knowledge of preventative measures lacks definitive proof, there are nevertheless some arguments for the use of various nutraceuticals and botanical supplements that may offer benefit. At our clinic, our clinicians have reviewed available research and we offer suggested nutraceutical and botanical supplements that may offer the potential benefit of reducing the risk of having a COVID-19 infection progress to severe or fatal outcome. Finally, before closing, I want to introduce the role of genetic testing as part of an integrative medical program. Genetic testing of an individual can provide insights into safer and more effective treatment of many conditions, including pain, depression, and addiction. Everyone responds to medications differently, including the medication's effectiveness and its side effects. The underlying basis for some of these differences is genetic, and testing can be an important tool in guiding medication management. To understand an individual's addiction, genetic testing is very important. Vulnerability to addiction is believed to be 50% genetic. Identifying a patient's genetic profile provides insights as to a patient's specific addiction risks, as well as guidance to more effectively manage their addiction. In conclusion, the management of many conditions, especially chronic pain and addiction, is best performed by engaging an integrative approach that includes conventional and alternative medications as supplements, as well as behavioral and mind-based practices. The inclusion of genetic testing available at our clinics can also serve to enhance individual-based treatment. Both Accurate Clinic and Emergency Life Integrative Medicine Center are currently out of network for all commercial insurances, and we do not accept Medicaid or Medicare. Accepted forms of payment include cashier's checks, money orders, debit and credit cards, but we do not accept cash. However, we do provide the service of submitting our patients' medical bills to their commercial insurance companies on behalf of our patients to gain them reimbursement. The amount of reimbursement will depend on the patient's insurance policy regarding out-of-network providers and their deductibles. You can visit our website at www.emergentlifemedicine.com and www.accurateclinic.com for more information related to our treatment programs. To all of you who wish to reduce or replace your dependence on harmful medications with healthier alternatives, you are most welcome to consult with us. Thank you for watching, and please be safe in these stressful times.